Greetings, everyone. In my just ended last video, I made mention of who is at risk of malaria infection, and I also mentioned some risk factors of malaria, and then I spoke about the cycle of malaria parasites. Okay, today in my video, I'll be talking about how we can prevent ourselves from getting malaria infection. But then let me just do some small recap, okay? I made mention in my previous video that what the effects of malaria infection on the woman may experience severe anemia. She might experience miscarriage, that is spontaneous abortion. She might, the risk of giving birth to, the risk of stillbirth is high, and she might give birth to premature baby, and there might be delivery of what? Low birth baby. Okay, so these are some of the effects of malaria infection on the woman. And then there are other infection of malaria infection there are some other effects of malaria infection on the baby. Some of these effects of malaria infection on the baby are: one, baby may develop symptoms of what? Fever. Baby may experience irritability. Baby may have breathing problem. Baby may have a feeding problem. Baby will be jaundiced. Baby will have anemia. Baby will have enlarged liver and the spleen. These are some of the effects of what? Malaria infection on the baby. So today I'm here to talk about prevention of malaria and the treatment. So how can we prevent malaria around us, in our homes, in our community? We can prevent malaria by: one, sleeping in a treated mosquito net. It's so surprising that mostly when we come to hospital and we've been given bed net to use in our homes, some people end up using the bed net as a fence in their backyard garden, in their farm, a whole lot. Some even end up selling the mosquito net given to them in the health facilities. So some of the method or some of the way we employ to make sure that some people who have been selling the bed net given to them, they don't sell it out, is that when we give to you in the health facilities, we tear part a small portion of the rubber that contains the bed net. Because if that portion isn't taken out, or if we don't tear a portion which you cannot sell it out, some people end up selling it. So for me personally, if you bring me a bed net that you are selling and the rubber has torn, I'm not going to buy that bed net. But still, people still go ahead and sell the bed nets, or if they don't sell, they use it for fence in their homes and whole lot and so on. So please, you kindly have to sleep in a treated mosquito net given to you in a health facilities, okay? Mostly, a lot has been invested in this mosquito net, okay? And then they give to you, you use it for what? Fence, whatever. And then you end up getting malaria infection and you will die. In my last video, I spoke about what malaria being a killer disease. It kills. If you don't know, I'm telling you today, it kills. So I mentioned that: one, we can prevent mosquito by sleeping in treated mosquito net. Two, we can use mosquito repellent. Okay, repellent, it's some kind of paste-like cream that you smear on your body when you are exposed in the night. Okay, you smear in your body where there is no clothing, or your body part that are not covered. You smear it on the body to prevent a mosquito from biting you. Okay, especially those pregnant women that are their own support system. When what I mean by their own support system is that they are everything to themselves. They look after themselves in pregnancy, during labor, and after birth. So most of these women in the night, you see them selling at the roadside. to make money, to feed themselves, buy clothing for the baby, for the deliveries, and so on and so forth. So you see them selling at the roadside. So this kind of women, we have to encourage them to smear mosquito repellent on their body when they are on the roadside or they are in the night selling. Or they can also wear protective clothing like pullover. Okay, they can wear pullover and then trousers whilst they are out there. And the part that are exposed, they have to use mosquito repellent to prevent mosquito from biting them. Okay, sometimes in another point is that we can also use what a window screen in this our modern generation. A lot of buildings are now giving a window screen. You can see sometimes when we are even passing, we'll be watching ourselves inside. How is our dress looking at? Those are the window screen I'm talking about. So those window screen, there are no holes that the mosquito can pass through easily and get to your room. And then we can also use mosquito coil and then vaporizers. Most people too say that they react to the mosquito they react to the mosquito coil. Okay, some too they say the coil is not okay for them, but they like the insecticide spray, the mosquito insecticide spray rather. So any of this one that you like, okay, if it is the coil, you get to put it in the room. You can even on the coil in the room for a time being and take it off. Maybe by the time you get inside, the scent and those kind of things that will make you react to it will be off. And then the same apply to the mosquito coil. Okay, so sleeping in mosquito nets, using mosquito repellent, using coil and vaporizers, wearing protective clothing, and then what? Using window screens. These are some of the ways we can adapt to prevent malaria infection. Okay, for the treatment of malaria, it is treated as such. Okay, they treat malaria how it presents itself. Okay, the first line of action, antacid is always used in the treatment of malaria, but it is not the most. Antacid is not the most or the most effective medicine used anyway. Okay, so please, you are watching a video on malaria infection. I thank you all my friends, my loved ones, my followers, everyone that normally take their time to watch my video, learn something and teach others. I thank you so much. I appreciate. But then keep on liking, keep on watching my video, and then keep on encouraging me to do more. And also after watching, kindly share. And then I always leave a link that takes you to my YouTube channel. Okay, after liking my if you are not able to watch on my Facebook page, you can always take the link to my YouTube channel. Okay, follow the link to my YouTube channel and then watch it there. After watching, kindly like. Okay, please, thank you so much for making time to watch my video. Have a good day. Thank you so much. Bye bye.